Hi, welcome back, Facebook friends. My name is Joe, and I'm your host here today. We are live here at the Lighthouse Treatment Center with our friend Stephen Cunningham. Welcome. Thank you so much for joining us.
Thank you so much for having me.
And today we are going to be discussing how to manage pain in recovery and, more importantly, how to stay clean through it all. So, Stephen, how did you start working in this field, and how long have you been in the field?
I've worked in the recovery industry for right around, let me see here, about 3 years or so, maybe 4. It just goes by quickly. It seems like a lot longer. About 3 years or so. I started in this field right as a house manager for a sober living company and helped grow that company to multiple houses, and went back to school and decided I want to become a counselor. And I started working with Chuck Richardson, and he helped groom me into the counselor and rose to become assistant director. And then I've kind of moved on and started my own thing and going from there. So I've worked in the industry for a little bit, seen a lot of things.
Yeah, there's a lot to see in this industry. So what brought you into this industry? Are you also in recovery yourself?
Yes. I used to work in the music industry, and one of the things that I wanted to help people more. You know, I enjoyed bringing, music to other people and stuff like that, but one of the things that really I found myself interested in was helping people, because I was helped, I went through right around 5, 6, 7 treatment centers, right around there. It took me 12 years to get clean and sober, and I wanted to help people do the same through working in a clinical setting. That was something that was really important to me, and I found fascinating. In college, I accidentally minored in psychology.
Oh wow!
On accident. I just thought it was interesting stuff, and so my interest in clinical work started in college, and before I even got sober, I was just interested and fascinated by abnormal psychology. So that's how I got into it.
Oh, good. Could you explain a little bit about your story? We were talking earlier. He has a really fascinating story, and it includes something that's very important to a lot of people, because I know that a lot of people will relapse because of their chronic pain conditions, and that's something that you've been challenged with most of your life, right?
Yes. So part of my story is that I am a recovered opiate addict, and that's something that I've dealt with for a long time. I shot heroin for several years, and before that taking prescription pain medication and everything. And part of the reason that I got into those drugs is because I suffer from osteoarthritis, and a degenerative disease that affects my joints. I've had 6 major surgeries in sobriety. I've had a total of 18 surgeries. So this is something that I've dealt with for a very long time, and pain has always been a constant in my life. It wasn't always severely chronic. There were times where I was better, where I wasn't on medication, but it slowly morphed into something that needed to be controlled with medication every single day. And I had to be able to learn how to, one, go into surgery in sobriety, to manage that ordeal, the trauma in and of itself of going through surgery, and also managing pain, recovery, and opioid medication, being an opioid addict. And that was something that was sadly done through trial and error, because my first surgery on sobriety, where I had a year and a half sober, I had a total knee replacement surgery, and that took me out. It was about a year-long recovery process to fully recover from that, and I ended up relapsing a few months into it on my pain medicine, and I learned a lot from that. But it was very scary to then face multiple more surgeries after the fact, knowing that the last time I relapsed, and that was really terrifying, being an opiate addict.
So what coping skills did you learn from that initial surgery that you relapsed shortly after?
I learned that one of my biggest coping mechanisms was, believe it or not, just being honest. I was really scared to talk about having to be on pain medicine to my peers in recovery, in part of the fellowships that I'm a part of, because I was really scared of being judged. I was really scared of being judged for having to take medicine. I was really scared, and also that first surgery, even though I had a year and a half sober at that point, I wasn't as active as I am today. I was a part of groups, but I had a sponsor and everything, but I wasn't actively participating with my fellows all the time. I was really more concerned about the girl I was dating at the time and work and stuff like that. So I put other things in front of my recovery. So being honest and participating in my recovery no matter what, and keeping recovery first, was something that I learned. And it wasn't until after a major relapse where I ended up shooting heroin again after a surgery did I learn some of these major mistakes. And I was able to take it when I was facing another surgery, learned what to do differently and coming up with a game plan.
So going back, you were saying you are part of some fellowships, and we were earlier talking about the stigma surrounding using medication even when you are in recovery. Do you want to talk a little bit about that?
Yeah, I was really scared of being judged by my peers. I've been, we all have judgments on other people. I mean, it's just part of being human. But we all want to feel a part of. I wanted to feel a part of, and I felt like it was something that was separating myself from everyone else because I had to be on an opiate medication in recovery.
Yeah.
We all know being an opiate addict, being on opiate medication in recovery is an oxymoron.
Yeah.
That's what it sounds like. And so I was really scared of what everyone else was going to think of that they were going to automatically think that I wasn't sober, that I was, or either that or I was relapsing, or I'm going to relapse, and they're going to distance themselves from me, or that I wasn't, I was just going to fall off the face of the earth, or stuff like that. So I was really scared about what other people thought of me. And my sponsors suggested to me that, going into this next surgery that I had, my next major knee replacement surgery, that I be honest, because I told them about all these fears, because I was scared to have surgery again, because I'd relapsed before. I was having to take opiate medication before surgery, during surgery, and after surgery for an extended amount of time. And so I was really scared to talk about that with people and be honest with them. And he suggested to me that I be honest with them. And it doesn't matter whether or not I get judged, because if I make that decision and determination to not be honest with them, I'm not being honest first, and that's me separating myself from the herd, thinking that I'm special and I'm different. And that puts me on the fringes and puts me in danger of my recovery, of relapsing. And to me that made sense because I'd done that before. I was on the fringes and I fell off. So what I did was I got in the middle and I raised my hand and I talked about it, because whether or not I was being judged doesn't really matter.
That was your truth.
Exactly. That was my truth. This is what I was facing in recovery, and it was terrifying to me. And I needed love and support through it. And sure enough, people were there. People were understanding. People were wanting to help and help me through this. When I was physically unable to get to meetings, I had people come to me.
Wow.
I had groups of men come to my house and bring me a meeting every single week without fail. And that was because I was honest about what I was having to go through, and that was extremely difficult for me to be honest with it. But I was also the best thing I ever did, because people may have judged me. Who knows? It probably did. I mean, I was on opiate medication and I was participating in meetings, and other people talk about it, and I'm like, oh, that guy's gonna relapse. He's talking about doing meds. Like, I've judged people. I've been that guy. While I've been on medication, I'm sick. I know. But what was great though is that I can be a resource for other people who have to go through this type of stuff. I didn't have anyone in my immediate circle that had been through these major surgeries or having to take major medications in sobriety and been able to be successful with it. And so I kind of had to work really close with my guys, my core people, a therapist, my sponsor, and all those people, and being honest with them, because that's what saved my butt, was being right in the middle and a part of and doing the extra work.
How has your pain affected your quality of life?
Now my quality of life is pretty good. Before, my quality of life was really miserable. Being in pain all day long, every day, is debilitating. Yeah. Whether I'm working with others, or simply trying to play with my dog, it was something that I physically had to know what my limits were. I couldn't go with my fiance for a long walk at Fashion Island. I couldn't go to Disneyland. I couldn't walk my dog around the block for very far because I simply just couldn't physically do it. So I missed out on a lot of things. I'm a very active, outdoorsy person, and I couldn't do the things that I loved most. Like I loved to go camping and hiking and paddleboarding, surfing, all those types of stuff. I wasn't able to physically do that anymore. So I had to limit my life quite a bit. And not only that, but mentally, it really does take a toll on me. Having to have almost a dark cloud of pain hanging over your head every single day, and trying to go about my work every single day while silently suffering is absolutely miserable. It makes you feel alone. It doesn't make you feel like you're really connecting with people all the time because I'm sitting there quietly suffering. Today is a different story. I've been off of all my meds. I had an amazing procedure done about 4 or 5 months ago. It's a spinal implant stimulator, and I've now come with a battery, wireless charger, and remote. And it's a device that's implanted in me, and it scrambles the pain signals to my brain and distracts me from the pain. I'm not pain free, but it allows me to have my life manageable without the use of opiates.
Thank you. So do you anticipate having any more surgeries in the future?
Knock on wood, I hope not, but
there's no wood around here.
Is that wood? I don't know. But I most likely will have to have surgeries. As part of having osteoarthritis and degenerative arthritic conditions, it gradually gets worse. And next is probably my hips or another knee or something. I've already had 3 knee replacements. I have 2 knees, so why not make it 4? I don't know.
Yeah.
But it's just something that I'm going to have to face. I'm going to constantly have more surgeries. Like my spinal implant lasts 5 years, and I have to replace that. So, at least in 5 years, I know I'll have 1 surgery.
Yeah.
Hopefully none at all, but it's just part of my story. I just keep having to deal with it.
So the last procedure that you had when you finally received your implant, before that you were taking opiates still.
I was taking narcotics. I was taking oxycodone.
Yeah,
I was taking oxycodone and morphine. I was taking right around about 160 milligrams of opiates a day. Being an opiate addict, my tolerance was already high, and also the significant amount of pain that I was in. I've had to be on fentanyl before in sobriety. I've had to be on morphine, oxy, all those fun, great drugs that I used to abuse. And it's like giving an alcoholic a shot and saying, "This is a shot of vodka," and saying, "Here, take this. This is your medicine.
Okay.
This is your medicine for the day, but you can't have any more than that."
Yeah.
It's a trip. It really is.
Yeah.
It's very difficult to have to take your drug of choice every single day just to have a manageable life. And that was really difficult.
Yeah.
And I sometimes, the only thing that I can say got me through that is something greater in myself walked me through that. I did a lot of the work, but something else carried me along the way, because Stephen Cunningham, the drug addict, the opiate addict, the heroin addict, should not have been able to stay sober through that. And sometimes I'm in disbelief that I have made it through that sober.
So in comparison to your initial surgery where you ended up relapsing, you said at that period you were in control of your meds. So this last time it was a little bit different, right? You had somebody else kind of hold you accountable?
Yeah.
Okay.
So one of the things that I learned is that a drug addict should not be in control of their medicine when having a major surgery. I thought because I had a 1.5 years sober at the time that I would be okay taking care of my meds. I had a good basis and a good foundation for recovery, and I thought that I would be okay with that. Yeah. And I did take them. I took them responsibly for over 2 months. I had one bad day and alone and miserable, hungry, angry, lonely, tired, in pain, and it took me out. It was that one thought of, maybe I'll just snort my meds today.
Yeah.
In my drug addict, my best thinking, I thought that was okay because it was just my dose, though. Then the next day, I'll just shoot up my dose.
Yeah.
But just my dose. And then I did that for like a couple of weeks where I was just shooting up my meds at the time that I was supposed to and the quantity that I was supposed to. That is not okay. That's not, my prescription bottle didn't say crush up, put in a spoon, drop, and shoot it up. It said take it orally. So I was relapsing. This time, what I did was I had a lot of people else hold me accountable,
right.
because that was something that I didn't have before. Picked up the meds at the pharmacist in a paper bag stapled shut with her initials written on it, handed them to my fiance, or you can even hand them to some other trusted individual, another family member, or someone else that you live with who's trusted, other people that are accountable and know what is going on. They were locked in a safe. She was the only one who had the combination to it.
Very good.
I could have broken into it. I'm a crafty little drug addict.
Exactly.
But that desire, of course, wasn't there. They were locked in a safe. There was a med log, all that kind of stuff. There was a lot of things that I put in place to ensure that there was a lot of checks and balances going on, so that I could not only be accountable for my medicine and what I took every day, because they were doled out to me as needed throughout the day, but also I had accountability with my doctors, with my surgeons, with my pain physicians, with physical therapists, with my therapist, with my sponsor, with
everybody,
with my fiance, with my family, you name it. Everyone knew what was going on and how it was being dealt with and how it was being handled. And I was honest with every single one of those people. And guess what? Those people could talk to each other. I made it so that everyone could talk to everyone. And that was really important to have everything laid out on the table so that we can all work together to make sure that I didn't slip up. And I made sure that I went to meetings every single day, as many days as I could, with my meeting schedule or physical therapy at the time and whatnot. Meeting with my sponsor, I had people bring me meetings. So there's a lot of different things that you can put into place in recovery so that you don't go off the deep end. Because one of the fallacies is that, I'm going to get these meds and if I have one, I'm going to take them all. And that can be the case for some people. It's not my story, but I was able to ask for help when I needed it most. I knew that I was not going to be able to take care of my medicine by myself, because I tried it once, it didn't work. Most people have to do things myself, be in enough pain to make a change. I have to learn from bad experiences, and I learned from that experience. And it doesn't have to be, your experience if you are suffering in pain, because you can ask for help. You can ask someone to help you be accountable. And that was one of the biggest things, was being honest and accountable in any way, shape, or form that other people felt necessary, because I didn't know best at this point.
Yeah, you made a really, really crucial point when you talked about letting your doctors know. So how important is it to disclose to your physicians, your doctors, your therapists that you are somebody who's in recovery, or at the very least somebody who struggles with opiate addiction?
Yes, I was honest with all my doctors and physicians from the get-go, because in order for them to treat me best, they need to know the whole picture about what they're treating. And so if there are alternatives to opioid medications or alternative treatments, which I asked for a million different alternatives before resulting to opiate medication. I was very resistant to taking opiate medication in sobriety, because I know what had happened before. I know that I'm an opiate addict. That's not, opiates and opiate addicts don't mix. And so I tried a bunch of different ways. I was very resistant to it, and finally I was in so much pain and suffering so badly. I had family members urging me, my fiance urging me, doctors saying, you don't need to be a hero, take the medicine, and they were willing to help me. And so I was able to voice my concerns and everything before doing it, and then have that accountability and that plan set in place after the fact when I did have to start taking it. And that was really important, to be honest with everyone, because in order to get the help that I needed to be honest with everybody so that they can treat me best. And if I'm withholding, usually it's for a reason. I'm planning something. There's something inside of me that's holding on to something, or I'm not in enough pain to let something go yet. But in this case, I'd already been down that road and had those problems in the past. So I knew that I had to fully disclose everything and lay everything out on the table to get the best help. And irregardless of surgery or anything, anytime that I've dealt with a physician, whether it be just my primary practice physician or anything else, I've discussed being in recovery and opiate addict so they can treat me the best way that they can. And who knows, there could be complications because of my history or whatnot. I was an IV drug user. There could be complications with a treatment that they're going to do because of that. So the best way for me to be treated is to be honest with them.
In your opinion, do you think that physical pain and addiction should both be addressed at the same time to be the most effective?
Yeah, I felt for me, after my surgery and relapse, I went to detox and I thought that I was going to be able to pick up my recovery where I left off, and I was relatively still new with in significant amount of pain from my surgery when I relapsed, and we didn't treat the pain and the addiction at the same time. We treated the addiction right there, detox, done deal, nothing, no more meds, and I was suffering bad. I was still like, I had they basically cut off my leg and reattached it with metal, and I was suffering pretty bad, being in pain, but I also knew that I can't take opiates because I just relapsed, and 6 hours later I had a needle in my arm. I didn't know what else to do, and so I had to go back into treatment, a few weeks later after I was able to get honest again. But it was really important because I found a physician and nurses and stuff at this treatment center who would listen to me and see my history for what it is, my medical history, and understand that we needed to treat chronic pain issues along with addiction at the same time. And that's not true for everyone, but they requested medical records, and so that they can work with my doctors and everything too, so they can also find the best treatment for me while I was in treatment, best treatment while I'm in treatment for my drug addiction, but also to treat my chronic pain to keep me comfortable that still fell within the guidelines of being in treatment. Most treatment centers won't allow you to take opioid medication while you're in treatment, but there are alternative ways to be able to manage your pain in sobriety while at a treatment center. And there are certain hospital settings or other medications that doctors may prescribe to help you manage your pain while you're in that. One of those pain drugs, believe it or not, is an antidepressant. A lot of these antidepressants, I was prescribed. I don't suffer from depression, but I was prescribed an antidepressant because it did help with chronic pain issues.
Oh, wow.
And because of the way they work on the same receptors as pain receptors and stuff, I don't know the full science behind that, but my doctor suggested it, and I thought it was a little crazy, but it did help. He put me in an antidepressant that did help manage some nerve pain that I was having. So there are alternative things, like I had no idea that antidepressants can help with pain. That's something that I learned through this process.
Wow. Have you had to mentally condition yourself to be able to deal with the pain?
Yeah, dealing with pain day in and day out is mentally exhausting. It can wear you down. I mean, it can mess with your libido. It can mess with just wanting to hang out with friends, want to go to meetings, go to work, thinking, concentration. It can cause depression and anxiety. It definitely did with me to an extent. When I'm in more pain, I withdraw more and I'm more quiet. My fiance made the comment to me that she could tell when I was in pain because I would get silent. I would just sit there and just be dead silent, just stuck kind of in myself. And it, over time of when you're dealing with it day in and day out, it's different than you burn your hand, you get burnt, and you're like, ouch. You don't have to kind of mentally prepare for that, but you learn to manage what you can and cannot do, but also you learn mental exercises and coping mechanisms to do that. There are certain breathing exercises, meditation. My friend Eric Duffner, who was actually just here at Anaheim Lighthouse doing breathworks, is something that he offered to me that helped me quite a bit to get into a right state of mind and everything, which was really cool. And even massage and all that kind of stuff helped, but mentally you learn to kind of deal with it on your own. Everyone kind of deals it with their own way, but talking again with a therapist was a big time. I've seen the same therapist for about 5 years now, and she knows this whole history. So that was a big thing. Talking with other peers and stuff, and again, just talking about what's going on internally. Whether it's I felt really bad for some of the people close around me because I felt like I was complaining all the time when I say would share in meetings or whatnot. What was going on? It seemed like I was sharing about the same thing. It was Groundhog's Day every day. And
but that was your truth at the time, and that's how you took the power out of it. Right?
Yeah, it did. It did to quite an extent, and then some of it is just making a decision. And God bless my fiance for putting up with me for so long and hearing and supporting me through all this, because I mean, she's a trooper, putting up with someone being in chronic pain, because not only it wears on significant others or family members. Seeing someone you love in pain all day, every day is brutal for them as well. And so she was able to help change my attitude and say, try to think of something more positive, or put your, think of something else, or meditate, or she would do something funny and take my mind off of it. Little things like that were helpful in trying to go somewhere else with it and not focus solely on suffering. Because it's hard when it's in the forefront of your mind all day, every day.
Yeah, absolutely. Well, I'm really glad that the quality of your life has drastically improved, and that you're able to really conquer your pain in a way. I mean, it's still there, but you've been able to manage it. What kind of advice would you give to somebody who is in a very similar situation?
Talk to people. Be honest about what is really going on, whether you're scared or fearful about having to take medication. Talk to a sponsor, talk to your counselor, talk to a therapist, talk to your loved ones, talk to your fiance about, or your significant other about what you're really going through and thinking and feeling, and also talk to your doctor. I had one doctor tell me that I was going to be on opiates for the rest of my life. I wouldn't take that for an answer, and my fiance helped me find another doctor, and I'm not on opiates anymore. I mean, that's incredible. That's something that's...
Get a second opinion as well.
Exactly. Getting second opinions. Don't take no for an answer, and keep working and pushing forward, because that's something that... and having faith, too. Faith that it will get better, something will change. So I really appreciate you having me on, and thank you so much.
Thank you so much. Bye, everyone.